Hello and welcome to Headline News in Breast Cancer from the recently concluded ASCO 2012 meeting in Chicago, Illinois. I'm Steve Highsmith. We have selected various research findings presented at ASCO this year, and we will review highlighted information from those selected abstracts. For a more detailed review of each of the abstracts, we encourage you to please click on the links below this video. The highly anticipated results of the Emilia study, a phase 3 trial of T-DM1 compared with capecitabine plus Lapatinib, were presented by Dr. Kimberly L. Blackwell of the Duke Cancer Institute. Although 991 were enrolled, 978 patients were treated in the study. Median dose intensity was 99.9% for those receiving T-DM1, 77.2% for those receiving capecitabine, and 93.4% for those treated with Lapatinib. Dose reduction was necessary for only 16.3% of patients in the T-DM1 arm. However, the capecitabine dose and the Lapatinib dose had to be reduced for 53.4% and 27.3% of patients respectively. Median progression-free survival was 9.6 months in the T-DM1 arm compared with 6.4 months in the capecitabine Lapatinib arm. Dr. Blackwell concluded that T-DM1 demonstrated greater efficacy and safety than capecitabine Lapatinib, and that T-DM1 should offer an important therapeutic option for the treatment of HER2-positive advanced breast cancer. According to Dr. Karen A. Gelman of the British Columbia Cancer Agency Canada, Trastuzumab prolongs progression-free survival compared with Lapatinib when added to taxane-based first-line therapy for women with HER2-positive metastatic breast cancer. This phase 3 trial compared taxane-based therapy, weekly paclitaxel or docetaxel every 3 weeks for 24 weeks, in combination with Lapatinib or Trastuzumab. Dr. Gelman concluded that in this study, PFS was significantly better for women who received Trastuzumab, with a 2.6-month difference for the intention-to-treat population and a 4.7-month difference for the centrally confirmed HER2-positive population. In the discussion section of the presentation, Dr. Günter von Minkwitz of the German Breast Group and the University of Frankfurt, Germany, said there is increasing evidence that Lapatinib is not as active as Trastuzumab in a number of breast cancer therapy settings, perhaps because of the rapid development of secondary resistance and because dual blockade appears to be the most promising approach for the future. The AZURE trial evaluated the use of zoledronic acid in addition to standard adjuvant therapy in patients with stage 2-3 breast cancer. Although analysis of the primary endpoint in the total study population showed no significant effects on disease outcomes, pre-specified subgroup analyses identified significant benefit in both invasive disease-free survival, or IDFS, and overall survival in women more than 5 years post-menopause. Zoledronic acid had no overall effect on IDFS or overall survival at a median follow-up of 59 months. Pre-specified subgroup analyses showed significant heterogeneity of treatment effect on IDFS between those who were more than 5 years post and all other menopausal groups. These results suggest menopausal status is more informative than age in the selection of patients for treatment with zoledronic acid. In women younger than 40, zoledronic acid may increase extraskeletal recurrence. The cumulative incidence of breast cancer by age 50 found in childhood Hodgkin lymphoma survivors who received chest radiation was equal to that of women who are BRCA1 mutation carriers, according to the results of a study that looked at data from the We Care study. The breast cancer risk among survivors of other childhood cancers who received chest radiation was also significantly increased, equivalent to that of BRCA2 mutation carriers. According to Dr. Moskowitz of Memorial Sloan Kettering Cancer Center, people know that risk of breast cancer increases with increasing radiation dose, and therefore people who are treated with moderate to high doses of radiation are getting screened annually. In the study, Dr. Moskowitz and colleagues at 26 institutions in North America examined 1,286 females treated with chest radiation for cancer who were younger than age 21 at diagnosis between 1970 and 1986. All participants had to have survived at least 5 years. 53% of participants had childhood Hodgkin lymphoma. The cumulative incidence of breast cancer in BRCA1/2 mutation carriers was estimated using 4,570 female first-degree relatives of 1,397 women with unilateral breast cancer in the WeCare study. These two groups were then compared with rates of breast cancer in the general public taken from surveillance, epidemiology, and end results, or SEER data. Participants were followed for a median of 26 years. During that time, 176 women were diagnosed with breast cancer, 147 of whom had had Hodgkin lymphoma. The overall cumulative incidence for breast cancer by age 50 for the cohort was 24%. It was 30% for Hodgkin lymphoma survivors. When looking at BRCA carriers, the cumulative incidence was 31% among BRCA1 carriers and 10% among BRCA2 carriers. When the researchers looked at the cumulative incidence of breast cancer by radiation dose, they found that even among those children thought to have received a low radiation dose of 10 to 19 Gray, there was a substantially increased risk for secondary breast cancers. The Children's Oncology Group recommends that childhood cancer survivors who receive 20 Gray or more of radiation to the chest area undergo semi-annual clinical breast exams, annual mammograms, and annual breast MRI starting at either age 25 or 8 years after radiation. And that's going to wrap things up on this edition of Oncology.TV Headline News in Breast Cancer at the ASCO 2012 meeting. Remember, if it's happening in oncology, it's happening on Oncology.TV.